Hello, I'm Ohio Governor Mike DeWine. Welcome and thank you for joining us today for this important webinar. Ohio is on the road back. Thanks to vaccines and thanks to your efforts, we're getting back to the things we loved doing before the pandemic. Together from the very beginning, we have been committed and consistent about prioritizing older Ohioans in our fight against COVID-19. That has been apparent through your hard work in facilities and also throughout the state of Ohio. The vast COVID-19 testing program for long-term care facilities has helped us identify and prevent additional spread of the virus in our nursing homes. Ohio worked to get PPE to care facilities even when the nation faced great shortages. We also made nursing home and assisted living residents among the first in the state eligible for the vaccine. As vaccines became more widely available, we ensured that all older Ohioans had access in what we then called Phase 1B. Efforts continued through programs such as the senior housing vaccine clinics and homebound efforts. Ohio also moved quickly and was the first state in the country to put in place a vaccine maintenance program for our nursing homes and assisted living facilities to ensure that every single staff member and resident had an opportunity, a continuous opportunity, to get vaccinated. Throughout the last year, we have worked diligently to ensure health orders struck the important balance between protecting physical well-being and mental well-being. That balance has been center stage for many of the discussions and decisions made with medical experts. As the community spread finally started slowing down thanks to the wide availability of vaccines in Ohio, we updated those orders once again. Now is the time when we transition from orders to guidance. The orders outline what should be done, but now you know how to protect older Ohioans and how to incorporate those best practices into the daily operations of your facility. Ohio continues to make tremendous progress on our road back, but you must continue to be vigilant. Now, we are still seeing some outbreaks. They're certainly fewer than they were before, but they are occurring. And as our nursing homes, assisted living open up with increased interaction, and comes increased risk of additional infection. So please continue the safe and healthy protocols. Mask up in healthcare settings, mask up elsewhere. If you're unvaccinated, get vaccinated. Continue good cleaning practices and reduce the chances of illness by holding activities and visits outside whenever possible. We're trusting you to continue the important work of protecting those who have been most impacted by this virus. We're looking to you, the leaders of our nursing homes, our assisted living facilities, our adult care services, and senior centers, to help lead the way into the next phase of the pandemic. I know that the last 16 months has been very tough, and very tough for you. It's been a strain on resources and a strain on you emotionally. Thank you for your dedication. Thank you for your compassion. Thank you for making Ohio the best place to age in the nation. We are a better, stronger, healthier Ohio because of you.
Thank you, Governor DeWine, and thank you all for joining us today. My name is John McElroy, and I am the Director of the Ohio Department of Aging. It has now been a year since the beginning of what is arguably the largest public health emergency most of us will experience in a lifetime. COVID-19 took aim at older adults, threatening their health, their needed services, their interactions with loved ones, and their lives. Throughout, you have been called upon to be brave, flexible, and resilient, among other things, and I thank you. While we are still in the midst of the pandemic, I am encouraged that we have opportunities like today to begin restoring the critical connections we all very much need. Ohio is on the road back, averaging less than 50 cases per 100,000 people. Effective June 2nd, Governor DeWine lifted the vast majority of public health orders, and most recently on June 18th, the state of emergency was lifted. During this hour, we will address the assisted living visitation order, testing order, CDC guidance, compliance, the Regional Rapid Response Assistance Program, and so much more. This time is dedicated to you. We have a panel of experts available to address questions for you. During this session, lines will be muted, but feel free to use the question function. We will make every effort to post helpful information, tools, and resources to address any questions you might have today. I will be joined by experts in post-acute and long-term care medicine, Doctors Marla Howler, Stuart Cantor, Thomas Lehner, and John Wigan. We'll also be joined by our featured speakers, Rebecca Sandholt, Chief of the Bureau of Survey and Certification for the Ohio Department of Health. And again, Dr. John Wigan, Chief Medical Officer of the Regional Rapid Response Assistance Program, or RAP, which you will hear more about later. Today, I will also be joined by my colleague, Dr. Bruce Vanderhoff, Chief Medical Officer of the Ohio Department of Health. And now a moment to discuss visitation. Since March 22, 2021, facilities have operated under the amended director's order to permit access to Ohio's residential care facilities with exceptions. Derived in part from the core principles and guidance from the Centers for Disease Control and Prevention, or the CDC, the order was prescriptive to support safe management of operations, capacity, and flow. It required facilities to allow indoor visitation at all times for residents, regardless of vaccination status, except in circumstances when visitation should be limited due to a high risk of COVID-19 transmission. To help control the capacity and flow of visitors, scheduling visits in advance, specifying the number of visitors per resident per visit, limiting the amount of entry points, designating visitation spaces, and requiring escorts were examples of state regulations that are now ending. Effective June 18, 2021, the order was rescinded. State regulations on how visits can occur have ended. For example, the state will no longer require advanced scheduling for visitors or limit the number of visitors a resident can have at any time. However, it will be important for each administrator to consider what is best for his or her residents, staff, families, and community. Although the order has been rescinded, it remains incumbent upon you as leaders to ensure sound clinical and safety practices, including how to manage capacity and flow safely. Visitation can be conducted through different means based on a facility structure and residents' needs. Some considerations: physical layout to safely distance and move about the facility, location of visits such as in resident rooms, dedicated visitation spaces, indoors, outdoors. Also, what visitation looks like for circumstances beyond compassionate care. You are strongly encouraged to continue evaluating the case status within your community, case status in the facility, staffing levels to support your plans while maintaining resident care, access to adequate testing for residents and staff, personal protective equipment and supplies, and local hospital capacity. It will be important to evolve your visitation policies in a way that is consistent with the prevailing CDC guidance. Educating residents and visitors about the risk of the spread of COVID-19 and the appropriate safety measures to take to protect themselves remains important. And having a sound testing strategy for staff and residents to support early detection of COVID-19. Regardless of how visits are conducted, there are core principles and best practices that should be integrated in your operations to reduce the risk of COVID-19 transmission. Assisted living facilities shall carefully consider all implications for resident physical and mental well-being when determining how to facilitate visitation. There are core principles that should be adhered to at all times. They include screening all who enter the facility for COVID-19, exercising good hand hygiene, utilizing face coverings or masks appropriately, social distancing at least 6 feet, posting instructional signage throughout the building, cleaning and disinfecting high-touch surfaces, insisting upon appropriate staff use of PPE, effectively cohorting of residents, and having staff testing and resident testing conducted properly. According to the CDC, they have created guidance specifically for nursing homes, but content might also be informative for assisted living facilities. Interim infection prevention and control recommendations to prevent SARS-CoV-2 spread in nursing homes summarizes the core infection prevention and control practices for nursing homes and long-term care facilities during the pandemic. Some of the recommendations can be modified in response to the vaccination. Modifications will be regularly updated in the document entitled Updated Healthcare Infection Prevention and Control Recommendations in Response to COVID-19 Vaccination. A bit about testing as vaccination coverage continues to pick up both inside the facilities and throughout the communities. I'll spend the next few minutes addressing the current state requirements and a new self-service tool to assist with ordering tests, reporting results, and requesting vaccine support. The director's order for the testing of the residents and staff of all residential care facilities was updated May 4, 2021, to require routine testing of all unvaccinated staff at least twice per week. Fully vaccinated staff do not have to be routinely tested. And regardless of vaccination status, strategic testing of all staff and residents shall continue. This can include testing staff and residents with known or suspected exposure, testing symptomatic staff and residents, or testing staff and residents as determined clinically necessary. As of today, this order remains in effect and adherence is expected and required. And while there is excitement about the progress made, we must be vigilant about using the tools we have appropriately. COVID-19 tests have been and remain important in our effort to swiftly detect cases and take action. This is a good opportunity to emphasize and to describe the concept of fully vaccinated. Fully vaccinated for our purposes today refers to a person who is equal to or more than 2 weeks following receipt of a second dose in a 2-dose series, or a person who is equal to or more than 2 weeks following receipt of 1 dose of a single-dose vaccine. This is an important point to note, as some staff and residents may be at the midpoint of a 2-dose vaccine, in which case they would not be considered fully vaccinated yet. State support will continue for testing efforts. And while state support is optional, adhering to the testing requirements set forth in the order and related guidelines is not. We have several options for testing. Option 1, alternating PCR and rapid antigen tests. Option 2, rapid antigen test only. Option 3, PCR test only. And option 4 is to opt out of state support. The COVID-19 Care Center is scheduled to launch June 28, 2021. This online portal has self-service functionality that can be easily accessed from our website with key functions consolidated in one place for easy navigation. Logging into the COVID-19 Care Center portal is easy and requires one sign-on to access all the functionality. Facilities with an existing vaccine maintenance program login will be able to use the same credentials to gain access. For those facilities without an existing login, your credentials will be sent alongside instructions next week. Each facility receives one login, so that several people within the facility can utilize the COVID-19 Care Center portal. Once authenticated, you can make selections to update your facility profile, complete weekly testing reporting, manage your state-supported testing options, and manage your vaccine maintenance program options. Additional features include indicators to alert facilities that their profile has not been updated in 30 days. This feature is a helpful prompt to update any point of contact changes, staff and resident census, or other pertinent information. There are also indicators that confirm required test reporting has been submitted. And for quick reference, the opt-in status for testing and the vaccine maintenance program are displayed along with the next vaccine clinic date. Testing program selections can be made at any time through the COVID-19 Care Center. Capabilities include aligning testing selections on shared campus settings, selecting and where needed, changing the preferred testing dates at any time, selecting and where needed, changing the program options at any time. For example, selecting antigen and PCR testing 1 month and perhaps antigen only the next. Selecting where needed, changing the lab selection. And if you elect to change the lab, a notification will be sent to the lab and to your facility point of contact. Vaccine maintenance program selections can also be made at any time through the portal. Once selections are made, once again, an email notification with selection details will be sent to the facility point of contact and the pharmacy that provides vaccine to the facility. Finally, testing reporting will be available. Upon submitting the weekly report, an email with selection details will be sent to the facility point of contact. In terms of next steps, once the webinar series is complete, all facilities will receive a welcome communication from our COVID team introducing them to the portal, a user guide document, and directions on how to validate your credentials, confirm the accuracy of the baseline profile information, and who and how to contact someone for assistance. We will monitor which facilities sign in and follow up with those who do not. Again, Monday, June 28th, we will launch the portal. And what this means is facilities will be able to self-select your testing and vaccine enrollment selections, lab and or vaccine provider, and self-order testing supplies. You'll also be able to update reporting information in the portal, and facilities, labs, pharmacies will begin receiving automated notifications from portal activities. We know that by increasing the number of residents and staff who are vaccinated, we can greatly reduce the risk of COVID-19 outbreaks in facilities, which helps protect the residents, the staff, and their families. Late February, we launched the COVID-19 Vaccine Maintenance Program for nursing homes and assisted living facilities. This program makes it possible for facilities to continue offering the vaccine to employees and residents who chose not to receive the vaccine earlier, but now want it, as well as offer the vaccine to new employees and new residents coming into the building. To date, 1,569 licensed facilities have opted into the program. 177 have opted out of the program, yet they have made us aware of how they receive vaccine from an alternative source. More than 3,560 clinics have been completed and reported in the vaccine maintenance portal. Again, if your facility is in need of vaccine, please utilize the maintenance program. So it's my pleasure to have with me today Dr. Vanderhoff, the Chief Medical Officer of the Ohio Department of Health. Dr. Vanderhoff, you have been instrumental during this pandemic, coming aboard in the fall and serving as one of Governor DeWine's principal advisors on COVID-19. It has certainly been my pleasure to work alongside you, and I have simply been fascinated by your vast medical expertise and collaborative approach to getting things done. Now, when you arrived, we were bracing for an anticipated spike in COVID-19 cases. The vaccines were not yet available to us, and we entered December with the infections and deaths continuing to climb. Then, mid to late December, the vaccine arrived, and Governor DeWine made the critical decision to prioritize congregate settings, in particular, those settings that serve older Ohioans, such as our nursing homes, assisted living facilities, and soon after, Ohioans aged 65 and older. Most of us understood that if we were to have a chance to reduce the infection rates and deaths, we would have to work tirelessly to vaccinate residents of nursing homes, assisted living, participants of our adult day and senior centers, and older adults in affordable housing communities and other independent residential clusters. Our cases began to plummet, and the desire to relax visitation restrictions mounted. For some, nearly a year had passed without regular personal contact with loved ones. Recognizing the benefits, measures were put in place to balance the two safely: physical health and emotional well being. Now, while we appreciate that with every visitor and every worker, there is a risk of exposure, particularly from those who are unvaccinated. So, while cases and deaths have declined sharply this year, there is still a risk. So, please tell us, are we ready to take this risk?
Well, thank you so much, Director McElroy. There's no question that earlier this month, June of 2021, Ohio achieved a benchmark that we have been looking forward to for some months. We are now reporting fewer than 50 COVID cases per 100,000 residents, a place we haven't been since June of 2020. Reaching this benchmark really is a positive sign, a sign that Ohio continues to move forward into a new phase of the pandemic. We're seeing daily cases of COVID-19 fluctuate in the low hundreds, whereas we are seeing cases, nevertheless, that are reported in the thousands each day when we look back to the peak of the pandemic. So it's a big improvement. It's a really welcome improvement. And as you alluded, I think we can largely attribute these improved case rates to our vaccines. Quite simply, the COVID-19 vaccines are working, and they're working very well. And since vaccines became available for older Ohioans and are now widely available statewide, we are thankfully seeing fewer and fewer cases, fewer hospitalizations, fewer deaths, both in our nursing homes and in our other congregate living settings statewide. So one could really ask rightly, well, what about masks and other precautions? Can we be done with those? And my answer to that is that although the data really is promising, as I've described, everything's moving in the right direction. Nevertheless, older Ohioans, particularly those who are unvaccinated, remain very susceptible to severe complications if they become sick with COVID-19. And we know that people who are in congregate living settings, such as our nursing homes and assisted living facilities, and even our older Ohioans who are coming for care during the day in our adult day settings, that's our most vulnerable population in the state. And when we look at the virus, we have to recognize that COVID-19 isn't sitting still. On the heels of the B117 variant that's now dominant in Ohio, we have another highly contagious variant, the so-called Delta variant, which is actually B1617.2, coming into the state. And reports from around the world suggest that this variant is making unvaccinated people sicker faster and is quickly replacing B117 wherever it arrives as the dominant strain. So continuing with COVID-19 precautions, especially in environments like nursing homes, assisted living, and adult day will add another layer of protection to help keep more Ohioans, especially older Ohioans, healthy. Now, the case rate in the general population, as I've referenced, is decreasing, and we're very thankful that we have reached and stayed below 50 cases per 100,000 residents. But progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, is why we're all feeling safer. It's why we are able to take some very welcome steps back towards the life we know, life without masks. However, we still need to take certain precautions in the settings that I've described. Our case rate in the general population has clearly decreased, and we're very thankful for that. It's decreased and it's staying below 50 cases per 100,000, but progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, that progress, that's what's allowing us to feel safer as we take important steps back toward the life that we have known, life without masks. But we still need to take certain precautions in the settings that I've referenced, in our nursing homes, in our assisted living, and our adult day settings. These are the settings where the population that is at greatest risk from COVID-19, when we look back at the data both in Ohio and across the state, are being cared for. And masks have long been used with success now in not only these settings, but in healthcare settings. And during this pandemic, we have seen just how beneficial masks are in slowing the spread of the disease, particularly among the unvaccinated. Just look at flu and colds. How many people do you know who actually had a flu or a cold this past winter? Not only is it a good practice to wear a mask in a healthcare setting, it's also recommended by the CDC, and it's required by many hospitals and healthcare providers. Now, for those who are unvaccinated, I want to remind everyone that the threat of COVID-19 remains very, very real, especially now with the global rise of the so-called Delta variant. And so we really can't let our guard completely down. If you're not vaccinated against COVID-19, please continue to wear a mask in public. And Ohioans that are able to get vaccinated really should. The COVID-19 vaccines are safe and they are effective. They don't contain tracking chips. They don't change your DNA or impact your fertility or magnetize you. What they do is protect you and others from getting COVID-19. Now, staff and residents in our nursing homes, in our assisted living, in our adult day settings who haven't yet been vaccinated really should talk to their doctor to learn more about the COVID-19 vaccines. Congregate living environments are really special environments where we need to care for and do care for some of the people who are most vulnerable to COVID-19. So in these facilities, we need to be especially careful about creating a COVID safe environment. In addition to taking precautions like washing your hands and wearing a mask, you should take extra care to think about how you can help us limit the spread of COVID-19 in the care environment where you work. So, for example, should we be cohorting residents who are ill or test positive for COVID-19? Of course, we should. What else can we be doing in the environment where you work to keep the people you're caring for and working with safe from this virus? A virus which, as we look back over the pandemic, has taken a very severe toll, certainly on the population of Ohio as a whole, but especially on our older citizens. So remember the important role that all of us play in helping to decrease the risk of spread of this virus, a virus which we're beginning to win the battle against, but a virus which is certainly still with us and which we still need to think about as we get up each day to go into our workplaces and care for some of the most vulnerable Ohioans.
So, Dr. Vanderhoff, I do appreciate you walking us through that very important information. And I think what I find most fascinating is the importance of understanding the difference between some of the guidance that has come out for the general population and why we have to be especially vigilant within these congregate settings. Can you speak to that just again for a moment?
Absolutely. So when the CDC came out with its guidance regarding what we can do safely when we are vaccinated, it was really addressing how we live our lives in more public settings. And there's no question that when we are vaccinated, we are very safe in terms of our risk of getting COVID-19 and even of transmitting COVID-19 to other people generally. But we know from our experience throughout this pandemic that certain settings pose a much greater risk for the transmission of SARS-CoV-2, the virus that causes COVID-19, and for the population that either lives in that environment or is served in that environment. And of course, some of the environments where we have to be the most careful are those where we are caring for our older Ohioans, or our older Ohioans are residing, our nursing homes, our assisted living environments, and our adult day settings. Those are settings where the guidance, along with the guidance for healthcare coming from the CDC, continues to point to the importance of COVID safety measures, including masking. The mask remains a very effective measure for us to help decrease the risk of the spread of this virus. So, thankfully, at this stage in the pandemic, we can feel really good about getting vaccinated and the safety that the vaccine provides us. But we have to remember that when we are in these environments where we are caring for vulnerable people, we have to take extra care and be extra careful. So one of the points I think it's important for us to remember is that the COVID-19 pandemic continues to evolve. It continues to change. And so therefore, the guidance, the healthcare guidance that we need to be mindful of will continue to evolve along with it. Our best guide for understanding what we need to do to keep each other safe is the CDC. And so I would encourage you, as this continues to move ahead, to look towards the guidance that the CDC provides regarding the environment in which you work, whether that's a nursing home, an assisted living facility, an adult day setting. The CDC will continue to be our best guide.
So, thank you for joining us today, Dr. Vanderhoff. We do appreciate your time and expertise.
Well, thank you very much, Director McElroy. I want to express my sincere appreciation and the Department of Health's appreciation for your leadership, as well as for all the wonderful work that so many Ohioans who are involved in every day in the care of older Ohioans have offered throughout this pandemic. Your hard work has really made a difference, and there's no question in my mind that the efforts of people in our nursing homes, our assisted living, and our adult day settings have made a difference in the health and the lives of Ohioans throughout this pandemic. So I'm very appreciative, as I know all the members of the Department of Health are, for the work of our Department of Aging and people in the elder sector.
I am grateful for the opportunity to provide information to Ohio's assisted living providers. With the state of Ohio opening back up, we must remain vigilant in our infection control practices. We should use reputable sources of information to continue to frame facility policies and procedures, even with the state of Ohio public health orders being lifted. Each residential care facility shall establish and implement appropriate written policies and procedures to control the development and transmission of infections and diseases. We would expect RCFs to take under advisement recommendations made by the CDC or other reputable entities in the development of these policies and procedures to ensure proper infection control measures are in place. It is so important to remember to get back to the basics. Remind staff of proper hygiene, the importance of social distancing, and wearing proper PPE when needed. Remind staff, even if COVID-19 isn't in the building, they should continue to follow all infection control policies and procedures to ensure state licensure requirements are met. Thank you again for the opportunity to speak with all of you.
Thank you. It's a privilege to address you, the staff who are committed to the seniors who depend on Ohio's assisted living facilities. As a physician who has cared for patients just like those who have benefited from the services you provide, I cannot put into words the appreciation that I have for what you do every day. This has been an extraordinary 15 months since the beginning of the COVID-19 pandemic. I have personally experienced the loss of patients I have cared for years. I've seen staff members who became ill with COVID and reached out to me for advice and medication. I've had family members who worried that I might bring the virus home to them. I've worn the masks and the face shields, the gowns, used tons of hand sanitizer, performed nasal swabs on other people and myself for over a year. So now that we are passing into this next phase of the pandemic, I'm excited about the prospects of returning to a life that is similar to what I remember prior to March 10th, 2020. I understand that it can be similar and that it will be similar, but it won't be the same. So yesterday I went to this grocery store and I could have bought as much toilet paper as I would have wanted. I actually saw Clorox wipes and Purell on the shelves. I can now visit my 85-year-old in-laws because we're all vaccinated. I can go to church or a concert or a Cleveland Indians game. Over the past year, I've learned so much about appreciating little things in life and the relationships that went away during the height of the pandemic. There are other things that I've learned this past year that everybody deserves grace, understanding, and patience. And make no mistake, the pandemic has affected all of us in ways that we may not realize. I've learned that over the course of the day, when I ask people how they're doing, and they pause and they look out at the horizon and they say, "I'm fine," that likely means that fine means feelings inside not expressed. So we're entering this new phase of the COVID-19 pandemic. And in fact, I've heard some people this past weekend say that they thought the pandemic was over. There are very few statements that I can say with certainty as a physician, and one of them is that the pandemic is not over. COVID is still in our communities. It is among us. And until the entire world can have the opportunity to be vaccinated like we have here in Ohio, the pandemic will continue to be a threat. Over the next days and weeks, it may seem like that threat has passed. We've been unwinding the requirements and policies that assisted living facilities have been living with for over the past 12 plus months. We will eventually be told that this is no longer an emergency. Nonetheless, the same virus that has disproportionately taken a toll on you, your peers, and the population we care for remains in our communities and among us. We now have at our disposal an abundance of safe and extremely effective vaccines that, if accepted globally, would end this pandemic. In the meantime, the virus continues to make millions and billions of little virus babies, and every once in a while, one of those babies is not quite the same, not quite so perfect as its parent. It's a variant. And eventually, one of these variants will be just different enough that the vaccines will not be as effective, and we could slip back into the outbreaks like we experienced last fall. We can prevent this from happening through vaccination and continuing to practice all the tried and true methods of infection prevention like hand washing and hygiene, wearing masks, especially around those vulnerable population, including the unvaccinated, and cleaning up after ourselves through sanitization of hard surfaces. Each of you need to decide to continue these practices through the remainder of the pandemic, even if the Ohio Department of Health or Governor DeWine or the Ohio legislature rescinds the mandate to do so. Testing and infection prevention and control needs to be a part of what we continue to do every day for the rest of the pandemic, even if we're not told we have to. This now becomes our responsibility. It's kind of like the analogy of school. We've made it through the elementary school portion of the pandemic where everything is laid out for us and we just have to follow the directions. We are now entering college, where we get to choose what classes we take and what path we follow. The Regional Rapid Response Assistance Program, or RAP program, for which I serve as the Chief Medical Officer, stands ready to support you and your organization through these next important months. The state of Ohio will continue to provide testing supplies like rapid antigen tests, PCR testing, and vaccinations against COVID-19. If you go back to the metaphor that we're entering this college phase of the pandemic, think of the RAP program as that guidance counselor that was always there to help get you through your schooling. The program is supported through the Department of Aging with money allocated to fight the pandemic. We have 8 regional medical directors, some of whom will be answering questions in just a few minutes. These medical directors want to help you and your team, and in some of your cases, your medical director, when questions arise about testing or management of COVID outbreaks or anything COVID. We have contracted with an organization of content experts in infection prevention who is available to you and your organization for COVID prevention and control, testing strategies, and to provide another voice to educate about the value and importance of vaccination acceptance. In medicine, we call this a curbside consult or a second opinion. And this is available to your organization at no cost to you. RAP has a call center that is available Monday through Friday from 7 a.m. until 7 p.m. Please reach out to RAP for assistance. We also have been making outreach calls to facilities like yours who may be experiencing COVID outbreaks to introduce the program and to verify the accuracy of the information reported to the Ohio Department of Health by local health departments. If you get a call from the RAP program, please accept it and understand that we're here to provide this valuable service and support to you. The most important aspect of the RAP program is that it is at no cost to you. It can save you time, it can let you concentrate on the services that you want to be providing, and very likely the RAP program could decrease illness and loss of life in the coming months. Thank you.
We'll go ahead and have our panelists come on, and we can get started with the question and answer portion of our webinar. We actually have an extra panelist that wasn't introduced earlier. We appreciate Dr. McLean joining us as well, so we will we'll be able to gain even more knowledge from an extra person. Thanks so much for being here, Brian. So what I'd like to do is have each of you introduce yourself briefly and kind of give a perspective of where you have intersected with assisted living facilities. And I'll also ask you to answer a question that I'll pose to everybody. So the question is, as we enter this new phase of the pandemic, what do you think are the opportunities and the risks that assisted living facilities over the next several months will have to think about as we peel away some of these recommendations? And why don't we start with Dr. Lehner? Dr. Lehner, thanks so much for all of your assistance with the RAP program. He's been a real confidant to me in thinking through the RAP program, and he's been very involved with the Ohio Medical Director Association, and appreciate all that time. Can you introduce yourself and also kind of address the question?
Thanks for that introduction, Dr. Wagon. My name's Tom Lehner. I'm a medical director in a couple of long-term care facilities. I'm also working with the RAP program and regional medical director for Region 1. So to answer your question, it's an interesting thought because as we begin to sort of peel back the regulations and get into more of an area where we can think for ourselves and make decisions, it almost seems like the pandemic is over. And I was at a Board of Health meeting this past Monday, and we had a public speaker there, and she was talking about how it's over and not to wear masks anymore. And it occurred to me that perhaps other people feel the same way, that as we begin to sort of repeal some of these orders, it may feel like the pandemic's over. And as Dr. Weingen and others have said, that couldn't be further from the truth. The virus is still out there. It's still alive and well. It is still looking for opportunities to make a home in one of our patients or family members and reproduce itself. And so we have to still be very vigilant. So how did we get here today from a year ago when we were still wondering what was going to happen? There was talk about a vaccine. Businesses were closed in many cases. Some people were working from home. Some people weren't working at all. Now we're opening things back up, and we're starting to see things as we did pre-pandemic time. The most important reason we're here now is because of the vaccine. People have gotten the vaccines, have really improved our ability to be functional and without all the masking and the other things that we had to do to protect ourselves and protect others. However, in the assisted living setting, in the congregate care settings, we still need to protect our residents as well as ourselves. The things we've taken for granted, we've done for years and years in healthcare as a physician. I know all of you as nurses and aides, etc. We all wash our hands. We all, sanitize and scrub down the surfaces that people touched. bedside tables, handrails, things like that. We still have to do some thoughtful use of masks when it's appropriate and safe, and social distancing when that's appropriate. Some of the hardest hit areas during the pandemic were memory care units and behavioral units. And for reasons that we all understand, realize with those patients, they oftentimes have cognitive impairment where they don't understand boundaries and safe practices. So their risk is much greater to get the virus and transmit it as well. So we have to be extra careful with those residents we all care for on a daily basis. So I think that we really can't let our guard down at all. We have to continue to be mindful of those practices that oftentimes come second nature, but they should be second nature to all of us, because that's how we're going to stay safe, keep ourselves and our families safe, as well as the patients that we care for. Thanks, John.
Thank you, Tom. Dr. Haller, why don't we go ahead and pivot over to you? So Marla Haller has just been a tour de force with the RAP program. In fact, I think she was doing a in-service on vaccination acceptance just prior to this, so we appreciate that. Dr. Haller, can you talk a little bit, introduce yourself a little bit, and then answer the question?
Sure. Thanks, John. Thanks, Director McElroy, for your support and our involvement with regards to the RAP program, and for your vigilance in promoting this program and for the safety and well-being of our Ohioans. So it's an honor and a privilege to serve. And yes, I just did a vaccine in service, and that is one of the areas that I think is real important with regards to an opportunity to reduce continued outbreaks, because, the RAP program has been doing some outreach, and what we found is that about 45% of our staff across Ohio, that's about the approximate percentage that is vaccinated. And so, that's really a concern, because we know that if the less that staff is vaccinated, it's more of an opportunity for exposures into the facilities, and it's exposure to our fellow staff as well as other residents. With that, I guess really, let me just clarify that statement in the fact that if less than 45% of the staff are vaccinated, COVID-19 continues to enter the facilities, and it affects both vaccinated and unvaccinated residents and staff. So the good thing with getting the vaccine is the fact that there's less likely of symptomatology with the residents and really with the staff who are vaccinated. We see less severity of illness if they do have symptoms. And so it's vitally important to really go back to what Dr. Vanderhoff said earlier, to squelch all these conspiracy theories that the vaccine's unsafe and so forth, because it is very, very safe. And, as Dr. Lehner had mentioned, COVID is still very prevalent, that we still have a threat of COVID. It's very real. COVID doesn't have any boundaries. And so I think our focus really, from my perspective, along with everything that Dr. Lehner has said, and I'm sure what Dr. McLean and Dr. Cantor will touch on, is the fact of we all have to be diligent in continuing with our processes to really mitigate this virus, and to try to keep our facilities and our residents safe. So I just encourage everyone to encourage your staff to get vaccinated. If you have any questions, certainly reach out to the RAP program. We are all ready and available to be able to do the in-services just like I did prior, but also focus on those primary care physicians who take care of your residents in-house. And if you have a medical director, reach out to that medical director. If that medical director is not sure which avenue to go down, have them reach out to us. And we'll be happy to share any educational tools that we have and to speak about the vaccines and the importance of COVID-19 mitigation.
Great. Thanks, Dr. Haller. Speaking of Dr. McLean, why don't we go ahead and pivot over to you, Brian. It's always great to have you on the webinars, and evidently you love doing them because you said that you could do this one. So thank you. If you can introduce yourself and what do you think about the risks and opportunities that we have moving forward for assisted living?
Sure. Thanks, John, and thanks for having me here today. Now, I'm an internal medicine physician who practices geriatrics and work in a group that is in several assisted living spaces, and happy to talk with all of you today about some of the risk that we've already talked about. Certainly, this virus has caused many changes to be put upon us, and in this new phase, we're in another spot of change. And I've had the opportunity to talk with so many of you over the past month, especially. And when it comes to testing and trying to keep facilities safe, there's been a real range from this is an excellent tool to have, really find that we're keeping people safe with especially asymptomatic folks that are infected, to the other end of the spectrum of, geez, this is really tough on staff. It's tough to staff, period, to all kinds of spots in the middle with that. So let's talk about testing as far as surveillance testing for a moment. As Director McElroy had said earlier, in an unvaccinated staff member, really that twice a week testing as we open up is the safest spot to keep COVID from being a widespread issue in a building. And while this certainly can be burdensome, we know that especially on the point of care test, that the highest viral load is in that 3 to 5 day window, which doesn't even extend out to a week period of time. And certainly with appropriate relaxing of restrictions and changes and mandates and not guidelines now, we're in a different period of risk. As far as symptomatic people, I would strongly suggest of any symptoms. We know that there's wide variability of symptoms with this virus. There may be a temptation to blame it on an allergy or something like that. Just test so you know what's there and what's in the building or not. As a breakout in any congregate living center is not just a very significant risk to health, it's also a risk to census challenges and staffing challenges within the building, which provide a whole different set of worries and circumstances. So I guess there are lots of things that we don't know about the future evolution of this virus, but there are some important things that we do know. We know that it is very much so still here, that it is extremely dangerous and actually more contagious than it had been previously. So as other folks on this call have said, I just urge continue with the vaccination push. That's our best tool. And please continue on the explanations of the why from the testing standpoint to try and keep everyone as safe as possible, at least for this next period and section of time. And it won't be forever, but we've got to get to the next point as safely as possible. Thank you.
Thanks, Dr. McLean. And finally, Dr. Cantor, welcome, and thank you for bringing your perspective and expertise as a geriatrician. Can you introduce yourself briefly? And boy, you get the unenviable task of answering the same question for the fourth time.
Well, thank you. I appreciate being here. My name is Stuart Cantor. I'm a geriatrician. I practice in post-acute and long-term care and assisted living, and I'm a medical director from the Society for Post-Acute and Long-Term Care. And I want to thank Dr. Wiegand, thank you, and Director, thank you for this opportunity to be involved in this webinar and to participate in the R3AP program. It might be a daunting task to go last, but my colleagues have done a great job in laying the building blocks for me to sort of deal with a specific issue that's on my mind. This morning when I watched the national news, Dr. Fauci was talking about variants, and Dr. Vanderhof in his introduction talked about variants, and then Dr. Wiegand, you talked about them as well. And one of the things that we found out during the R3AP outreach program is that of the 74 facilities that we contacted who had positive cases in residents or staff, none of them were aware of the fact of the recommendations by the Ohio Department of Health that if a fully vaccinated person develops signs or symptoms and is tested and is positive, then the recommendation is for genomic testing of their PCR sample to make sure that we identify, is this a variant and what type of variant? As was stated aptly before, viruses are constantly rebuilding and constantly mutating in an attempt to stay relevant. So we want to make sure that we stay on top of variants. The Ohio Department of Health and the R3AP program want to help facilitate the use of genomic testing. So please reach out to us so that we can help you with that if needed. We also want to make sure that people understand that as of today, to date, all the variants have been covered by the COVID vaccines, but we want to make sure that that continues. And we define someone who is positive or who has signs or symptoms who is suggestive of COVID, loss of smell, shortness of breath, respiratory disturbance, those type of things, not really a scratchy throat or kind of minor symptoms. So it is my hope that through this communication, we'll continue to stay vigilant about testing and specifically about genomic testing. And I agree with all the sentiments previously stated that we're still on the playing field. We're probably between second and third base, but we're by no means at home plate yet. So thank you.
Terrific. Director, do you want to go ahead and start looking through the chat and providing some questions from the audience?
Absolutely, and I would encourage everyone in the audience to please feel free to enter your questions. This, again, is your opportunity to ask questions of this panel. So one of the questions, it's a blend of multiple questions and comments. The federal guidelines require once-a-month testing. Why are facilities testing at 9 times this level? Couldn't that time be better spent? Wouldn't at least once a week be a more reasonable level at this point when the state positivity rate is less than 2.5% and resident vaccination rates are 95% and up? So before the panel takes it, I would like to offer a few points of clarification for the audience as well as you as panelists so you can adequately respond. I think the reference to the federal guidelines is more specific to CMS, which is specific to nursing homes. With respect to 9 times more, I'm not sure if that's the number I would use as much as perhaps in some situations it could be argued maybe 8 times more. Right now, what CMS requires is if you have a facility within a community that is at low county positivity or less than 5%, they can test once a month. If you have a facility that is at that sort of medium level of 5 to 10%, they can test once a week. And then otherwise, if you have a community that's greater than 10%, you'd then be back at your twice a week. I think so that, again, we have clarity. Right now, the order for assisted living facilities is for them to test routine tests unvaccinated staff twice a week. So again, that's routine testing for unvaccinated staff at twice a week. There's also a comment that the resident vaccination rates are 95% up, and I want to offer a bit of clarity on that before you have to answer this question. Based on the numbers reported to the Ohio Department of Aging, we estimate 45% of staff are fully vaccinated and 76% of residents are fully vaccinated. Now, I want to qualify this point that this is not an inclusive estimate, nor is a reflection of those who have refused the vaccine. The total number of staff and residents reported by the facilities are constantly changing because of the ongoing inclusion of new staff members and new residents within the counts. Also, the number of vaccines administered do not include any shots provided through partnerships with local health departments. And so I earlier referenced that there were more than 1,500 licensed facilities that are within our program, and there were about 177 outside of the program that have an alternative means to get the vaccine. So my point here is that we have average numbers. There's an opportunity for those numbers to fluctuate. And finally, there's great variance across the state. One facility is one facility. And so in some cases, we may have a vaccination rate or coverage of 95% with our residents, but perhaps in one down the road, you're sitting at about 75%. Likewise for staff. We have some facilities where the staff rate is considerably high, and in others where perhaps it is considerably low. I think the point here, and what becomes really important when you begin to answer this around testing, I think is what I don't want to lose sight of is the emphasis on the sort of inverse relationship with the vaccines and the testing. To the extent that we can increase the vaccination coverage within the facilities, in other words, we can bring it up, we can then get to a place or more of a posture where we can lower the testing. And so I will turn it over now to you, Dr. Wigan, and the panelists. I wanted to be sure that we had clarity when you answered the question.
Thank you. Well, I think as panel, why don't we talk briefly about the difference between the PCR, what you get with the PCR test, and also what you get from a point of care test, because I think those are different. And I know, Dr. McLean talked about testing, and I don't know if, Brian, you want to take the first swipe at it, and then we can all kind of chime in. What are your thoughts about the idea of, well, first of all, I'll just ask, from the standpoint of what's the usefulness if we were to just follow what the federal guidelines were of just testing once a month?
Sure. And first, I'd say that I, as all of us, are looking forward to the day when we don't have to do any testing, and certainly not doing routine testing. We're not in that risk window for a few reasons. When we combine the increased social gathering and decreased restrictions with an increase in infectivity of the virus variant, we've got a real cauldron of risk there. And as the director was talking about some of the numbers, we have half of our staff, and let's just take a typical building, maybe half the staff is not vaccinated. If we have a breakout, we know that there are going to be 2, 3, 4 week period that we'll be trying to staff the building with a good 20 to 25% less of the staff that we currently have. Also, if we take a 100 apartment building and say 20% of them are not vaccinated, if we just look at statistics, that would mean that 6 to 7 people would not survive, and 6 to 7 people would have a permanent change in health status, that they would not be an assisted living appropriate person anymore. So it's a very serious matter on this piece where we're at in this particular risk corridor. This is not forever, but it certainly is the spot that we're in now. As far as the point of care test, we have a short window that we can pick up the viral positivity with that. Most sensitive in that 3 to 7 day mark, which really puts us on that testing profile. If we were only testing once a month, it's kind of like a lottery system. Then if you got lucky in that kind of 3 to 5 day window, but the rest of the month, we have no idea where we're at. And again, this is not a piece that's forever. It's trying to open back up, get back to the things that assisted living does so well, makes life and living better, able to show off what you're doing in community. So I think those were just some of the thoughts that I had with that.
Yeah, and I think as I've tried to talk to facilities about this, I think generally Monday, Thursday is the cadence that oftentimes they do that. And if you think about, being tested on Monday and it being negative, and then perhaps catching it Monday evening, those symptoms start to present potentially the infectivity, for that individual would start, on Wednesday, Thursday, or Friday. And if we're only checking it even once a week with a point of care test, the cat may be out of the bag, so to speak, in that case. Dr. Lehner, do you have any additional thoughts?
Well, I do, and I think that the testing is a way for us to keep track of the variants that Dr. Cantor spoke about. If we don't test, we're not going to find those positive residents or positive staff members that may or may not be vaccinated. But if we don't identify those people, we're not going to be able to identify where the variants are in the state of Ohio. And that's really, I think, another important part of testing, because we need to be sure that the vaccination that is being offered remains appropriate for the variants that we're going to begin to see eventually. And we won't know that if we don't back up and get the right testing. So testing also helps us identify those patients and the visitors as well, and their families, if they choose to get tested there or somewhere else, if they're asymptomatic and positive. They could be shedding virus and nobody knows that they're shedding virus, and they're in visiting a family member, or they're home with their own families. And when I've spoken to groups before, I said, as a physician, I need to protect myself first with the shot, with the vaccine, protect my family, as well as protect the patients and staff that I work with. So this protection goes all the way around. And I think that the bit of work and the hassle factors, so to speak, of having to test more frequently is well worth it at the end, because we're protecting our staff, ourselves, our families, and obviously our residents. So really, I don't think you can overstate the importance of testing.
And I think one thing I wanted to add in the outreach calls that the RAP program has done, and all of these individuals who are speaking to you today have participated in that. We have found in assisted living a high rate of acceptance of resident vaccination. And so some of those numbers that I think Dr. McLean was speaking about, the risk of an outbreak in a facility that has high acceptance of the residents, that bodes well for the facility. It's where the staff have had low rates, and we've had some facilities that have been as low as 20%, and those are the ones that have cropped up with 10, 12, 15 cases over the course of a week, and we've called out and just tried to make sure that there isn't anything that we might not be able to help with in that case. But in many cases, I think the facilities that are listening have done a great job and continue to do a great job promoting the vaccination maintenance program. Dr. Cantor, Dr. Haller, do you have anything to add?
I do not. I think all the points have been very well stated.
Exactly.
Okay, so the next question is, are we able to send antigen tests for genomic testing or only PCR? How would that work with a PCR test, since the lab would process that and the facility wouldn't receive that or get that back?
Yeah, that's a great question. And the PCR test is the only method by which you can test for the genomic sequencing. So the Abbott Binax Now cards, you can't use those. And we're actually working with the RAP program is actually working with the Ohio Department of Health to try to figure out a seamless, easy way for us to be able to provide that. I know a number of you may use an outside lab like Mako or something like that, which I think is in North Carolina or something. And so you send off this swab and and if you call Mako and say, hey, it came back positive, can you send it to the Ohio Department of Health? They'll say, we have no clue what you're talking about. And so we're working through a method of being able to provide the swabs. And that's part of the challenge, I think, is we ask you to do something and then we don't have an easy method for you to do it. The likelihood is it's not going to get done. And so we are working on that. But the way I would envision this happening is, if you're using the rapid antigen tests and one comes back positive, so let's say you're testing a unvaccinated staff, or if you have outbreak testing and you're testing everybody, if you have somebody that comes back positive on that rapid antigen test, and you said, okay, now they're asymptomatic, so we have to confirm it with a PCR test. Most likely what we're going to have you do is confirm that, but also do a second PCR test and hold that. And if you get that confirmed, then send the second PCR swab to the Ohio Department of Health.
Okay. Trying to read through a few others. Any thoughts on when booster shots will be necessary? I assume this is for the vaccine.
So Marla, you want to go ahead and, I know we don't have our infectious disease specialist who is in all the research projects and everything with us today. So we'll let you stand in for Dr. Joe.
Sure. So we really don't have I guess the valid studies to confirm that we're going to need a booster, but in a lot of the preliminary research that has been done, it appears that we will need a booster. We get an annual flu vaccine shot every year, and that annual flu vaccine, some people have referred to it as, well, that's our booster every year. And that's because, they look at the different types of influenza, and that's how that they manufacture that influenza vaccine. So preliminarily, I would plan on getting that booster. I think it's going to be important. We don't know how long that the antibodies from our first set of vaccines really fully last. We are in a lot of research trials right now. I know Dr. Jump, who is our infectious disease specialist, she is in one of those research trials. We think that they last a minimum of 8 months, sometimes longer. So really, we're just kind of in limbo right now. But I would say plan on getting that booster. I know I'll be first in line to get that booster when it comes out. So.
Dr. Cantor or anybody else? Okay, that's fine. Let's get them.
I would just echo what Dr. Holler said. I think that I'm not a virologist, but in listening to the virologists that have been discussing this issue, I think it's very likely that we'll require boosters. I think there's a lot of variance in how long antibodies last. I am a COVID recoverer, and I've been involved in a study where they continue to try to look for antibody levels because there is a lot of variance. So again, I would predict that we will get boosters in the future.
Okay. Staff are expressing concerns about reports online that state that test swabs being used for COVID-19 testing contain a carcinogen. Can you address this concern?
Well, I have not heard that. So that the test swabs have a carcinogen? And are those the point of care tests or the PCR tests?
It doesn't state. It just says that test swabs being used. So if it's not something we've heard of, is it something that maybe we may want to provide a later response on? But I don't think I've heard this raised either.
Yeah, and I think the standard, I know that early in the pandemic when we were short on toilet paper and we were short on swabs, they were doing 3D printing of those. I know that now they've caught up to that and they're using standard standard swabs that like we use in medical offices, I think, quite honestly. So I would be surprised by that, but I don't know the answer to that, which is one of the benefits of being a doctor. You can say, I don't know the answer to that. But we can research that, and then we can leave it to Director McElroy to figure out how to disseminate the knowledge that we figure out.
Okay. All right, next question. Many nursing homes in our area are doing, and this is in quotes, open visitation. And we are being pushed by our families to do open visitation as well. No scheduling. How do you feel about open visitation if we have 0 cases and have had 0 cases in months? So I don't know, Rebecca, if you want to touch on this, and then I have some words that I want to offer to this as well.
So I would say open visitation is fine as long as you're following those core infection control items, principles, that you have, you're cleaning surfaces, you're ensuring masks are being worn when necessary, that you're educating your staff and visitors on the importance of that social distancing. If close contact is needed, that the resident wears a mask, and to get that hug or that touch from their loved ones. But I think that open visitation is fine, especially if individuals are vaccinated, and but also that you're, maintaining a list of who's coming in into your facility, because it's important for you to recognize that if there were cases and there was an outbreak, there needs to be some mechanism for that contact tracing to occur to notify those families that they may have had a potential exposure. Director?
I agree with everything that Rebecca has stated. This all really comes down to making sure that whatever you put in place, that you still have the ability to maintain the core principles. And I think she just referenced some of them. Keep in mind, the physical layouts of the building vary widely. The amount of staff you have and how you position your staff could vary widely. This comes down to your ability to be able to maintain the control and flow. Can you manage having open visitation in a way that allows you to still be able to maintain those core principles of infection prevention? If you are in a position to do so, then I think you could safely manage open visitation. If not, then perhaps your visitation policy needs to contemplate that. You need to put the correct measures in place. So this is where, and we are at the point now where we will certainly point you to guidance. We will certainly remind you of those core principles. But in this case, the state regulations that are very prescriptive on how many visitors you have to schedule, you have to escort, these are things now where we have removed ourselves, but we trust that you will follow the guidance, that you will appreciate what those core principles are, and you will put in place a policy that balances resident rights. The families need to be able to come in and see their loved ones with your ability to still maintain those core principles. So it's going to vary based upon your building, based upon your capabilities, but keep in mind, you have to be able to balance those two things. And I don't know if anyone else has anything they want to add to that piece before we move on.
That sounded pretty thorough to me.
All right. Let's see here. I think this answered that question. This is still testing. This is about the swab again. This is a question about visitation in common spaces versus individual spaces. Should visitation still take place in their room and not in the common spaces, or does that depend on our individual policy? My immediate response is going to be your policy. Again, it sort of goes to the earlier points that we raised, but I don't know if others have anything they want to offer.
Yeah, I think what I would say before opening it up to the panel is, this is your opportunity to kind of think through everything that goes into a visitation policy and figure out where you have the ability to kind of stretch. Visitation is absolutely so important, and it was lacking for so long that I think, especially in assisted living, there's a lot of flexibility there, but you want to be smart about it from the standpoint of you don't want to get an outbreak at the same time. And so, certainly outdoors is better than indoors, unless it's the middle of the winter in Ohio, and then you may want to rethink about that. But any other thoughts that you all have on the panel?
I think that you have to use your reasonable insight and make the steps that being a bunch of people in an extremely closed space is not as good as a few people in an outside space. So I think you have to use those same principles and just make sure that we're always mitigating risk for the vulnerable people that we serve. And we know that those are the people that you have to protect in the equation.
And then there are some general questions here to close it around, will slides be available? Absolutely, all these things will be available. One last point, I see this has come up a couple of times. I do want to bring this up. And this one, I'll read it in its entirety. I appreciate the guidance to follow the CDC, and we're doing just that. People and visitors still are angry and irritated. We need that put out there for families. They continue to say, the governor listed everything. It would be so much better if we had it in writing that we are strongly recommended to follow the CDC. It feels very much like we are unsupported, and it is very conflicting information for families to hear that everything is lifted, yet we do still need to follow the CDC. Is there anything out there in writing? So what I would say, when the governor has announced it that we're lifting things, he has also balanced that message with, but the federal guidelines are still in place and that we will still recommend that the facilities follow CDC guidance. However, to your point, the average family member, most people, they may not know or have familiarity with what all is involved with the CDC and what that means for you. And so we are certainly trying to educate not only our facilities and providers, but also families. In fact, tomorrow, I will be addressing the long-term care ombudsman and how they will communicate with families so that there is that awareness and so that there's appreciation for this balancing act that you are being asked to carry out. We will continue to message to the public how important it is to put in place those things to mitigate the risk of transmission, and how the things we are doing in a stepwise approach as we have always done. And so I appreciate the comment. We'll be very thoughtful about it and try to be certain that we're pushing as much messaging out to the public as we are to you as our providers. And so with that, I don't know if there's anything else from the panel with respect to RAP or the surveyors or anything else we need to say to conclude as we're close to our time.
Yeah, so the power of Google is that you can look up things while the director's talking. And so the question about the swabs actually comes out of Great Britain. And apparently there was false claims and that it's been debunked, at least on several of the things that I've read just quickly, that ethylene oxide is sometimes used to sterilize swabs in the European Union. That doesn't appear to be anything that is being done in the United States or in Ohio or anything like that. But I think that that's where that comes from. And there's a number of resources online that fact check that. I think this goes to a lot of things that are about COVID. And how, and even here in the United States and in our own state of Ohio, we have heard things that have occurred that really you need to figure out how you can get the right answer to those things. And the RAP program certainly could be one. Your medical director, if you have one, could be another resource. But the challenge I think that has been from the beginning has been that there are a lot of I guess false information that's out there, and it has caused, I think, some delay in our ability to have wide acceptance to a lot of things. So that would be my last comment, I guess, except that I do appreciate the ability to do this forum to communicate, and I think hopefully it's useful to the people who watch it.
Absolutely. And I want to thank all of our panelists and our speakers for giving their time and their expertise to this very important topic. Our commitment to you is that we stand ready to support you as a part of the response team, but also we will continue to push out information that you will find useful. I see comments on here, for example, that information has not been updated by the CDC and CMS since March, and I know there have been updates in April and May as well. And so I think maybe where we can be helpful in that space is to try to continue to refresh and push out that information so that you will know where to find it or be able to access it pretty easily and pretty readily. So with that, we want to thank you for your time, for your expertise, and what has been a very long effort and a continuous effort on your part to keep so many people safe. Thank you, and we look forward to being in touch.